Happy Thursday. It's Doc Edwards from Mama's Chiropractic. I'm coming to you for this live for patients who are curious about whether or not chiropractors should be staying open during this point in time. If you aren't a chiropractic patient and you have questions about whether or not chiropractic is an essential service, this video is definitely for you. So I've had some questions over the last couple of days about why we as chiropractors are staying open. And it helps me understand that the message that's been communicated for probably a long time by our profession is that people were perceiving chiropractic to be like maybe some kind of massage that makes people's bodies feel good, or maybe that what I do is pet babies or rub bellies or something like that. Not really having an understanding about what it is that I do on a regular basis. So I just wanted to explain that a little bit. Today in my office, I ended up having a brand new patient. She's pregnant, who's been in a car accident. Neurologist, PT, ER, NRPs, they all pretty much just kind of like sent her on her way. What happened with that car accident, she had a vertex baby, a head down baby, who is now transverse. So although at her point in time in gestation, about a quarter of all babies have a change in position, the accident has also created a hypermobility issue in her pelvis. And the way that the pelvis will respond to that is by going into spasm, which will make her birth a lot more difficult if we weren't here. I can say that with confidence because the research that we've done out of this office says that there's a clear benefit to being able to address things like hypermobility in the pelvis if we do it early. So we're going to be able to catch her, and from the research that we've done in our office, change the arc of her labor and her birth. I also had a family come in who was really concerned about the cough and sneezes that their young children had. Because of all the concern about things like COVID-19, they were worried that their children had it. Part of my job as a physician, licensed in the state of Florida, is also to do triage. I am a primary portal of entry doctor according to my license, which basically means that when people come in with things, my job is to make the decision about whether this is something that can be managed conservatively or if it's something that needs to go up the chain. Right now, considering our healthcare system is going to get inundated with people who need medical intervention to end up helping their lungs work better, I think it's a really smart idea to have frontline providers like me. They're able to provide conservative care. By conservative, what I mean is helping to make sure that their brains and their bodies are talking as clearly as possible, that their lungs are able to expand properly because the realignment of their ribs and the thoracic cage is all working the best that it possibly can. What I was also able to do is help guide her through an infographic that we found and then we posted to our Mama's Chiropractic Facebook page. This infographic I found super, super useful. I'm really, really impressed by the people who put it together. It helps you understand the symptom differences between things like COVID-19, influenza, regular cold, and seasonal allergies. There's a couple of things that I just want to highlight really quickly. If you've got a runny, stuffy nose or somebody sneezes next to you, it's not coronavirus. If you have shortness of breath and coughing and a fever, you may want to go seek medical attention because chances are those are the same symptoms that we're seeing with this. If you have diarrhea, that's a rare complication. So if you bought a whole bunch of toilet paper expecting that you were going to poop your pants a lot, joke's kind of on you. You may want to donate some of that to your neighbor. What we're going to do here is, as far as chiropractic care in our office, if you have any questions about the necessity of that, I want you to ask some of the patients that came in whose baby has colic and isn't sleeping. I want you to ask some of our patients who have breech babies and they get adjusted on a daily basis in order to get balance in their bodies so the baby has the best ability in order to go head down. Some of the moms that are attempting trials of labor after cesarean at home and are trying to make sure that their bodies are as prepared as possible to go ahead and make that birth happen the way that it's supposed to. Chiropractic care has a really long history, especially the research that we've done out of our office at being able to help people, not just with these things, but help their bodies work optimally. That's the reason why when Chiro Futures, a malpractice insurance company, wrote a position statement on the utility of chiropractic care during this pandemic, is one of the biggest points that they made, is that chiropractors, as we're trained, are here as doctors. We're here to help people because we have the same amount of knowledge, but what's different is our skill set. My skill set, my orientation towards health is different from medical doctors. Medical doctors look at the treatment of disease through the use of drugs and surgery. What they do is exceptionally necessary to treat disease. They're excellent when you have trauma to your body. They're very good at dealing with that. I get hit by a bus tomorrow, take me to the hospital, right? But then what my job is as a chiropractor is making sure that we do the things to help build health. Clear communication from your nerve system to your immune system effectively turns your immune system into a chemical extension of the nervous system. Making sure we're eating good food, getting plenty of rest, and by all means, stress reduction. Among the cases that I had in my office today was a mom who was just breaking down. The stresses of everything had just totally gotten to her. And some of the research out of our office suggests that we can actually change brain firing based off of the adjustments that we. When that mom's able to go home tonight to kids and she's less stressed, I'm willing to bet that's also going to change the conversation in her family. So if you have questions about chiropractic, please ask me. Send me an email. People say, you know, I don't understand why you're open. I don't get what chiropractic's all about. Is this for me? I'm here to answer these questions. I've been answering these questions for 20 years. You aren't going to ask me a question I can't answer. Trust me. If I don't know the answer, believe me, I've got a resource somewhere in this big old computer of mine to be able to find and send to you, because I know that a lot of our patients are also fans of what we do as far as natural health care goes. And their friends and family are asking them for resources. So we're trying to get out as much information as we can. Check out our Facebook page, Mama's Chiropractic, if you want to stay current with the information. Please check out our YouTube channel and subscribe to that. We're going to continue to post videos. We're going to be super active over the next month to make sure that we can all get through this together.